Two children younger than 2 years old died in hot cars last week on 2 consecutive days. The traumatic scenes were a reminder that first responders can be emotionally affected by what they see. Our Brandon Schaff sat down with the Corpus Christi Police Department to learn what mental health resources they have for their staff in tonight's top story.
In Corpus Christi, a mother left her 22-month-old daughter in her car last Tuesday for hours. She told police that she forgot to drop the child off at daycare. It happened again the next day in Beeville. A grandmother left a 9-month-old girl in a car, forgetting about her when she went inside a house. Both children did not survive. As CCPD responded to the incident in Corpus Christi, officers were seen comforting each other at the scene. The officers that were responding there, you could see the emotion on their faces. You could see the need for them to console each other in that time, in that moment. How important is that to have that resource right there in real time, the officers being there for each other because they know what they're going through?
That is exactly what peer support is about. We are peers and we provide comfort to each other because we know. Your peer knows what you're experiencing and what you're feeling.
Corpus Christi Senior Officer Denise Pace said that the department has a 34-person peer support team made up of officers and civilian employees. It includes dispatchers, crime scene technicians, and more. 2 licensed counselors and a psychiatrist are also available at any time. Why is it important that those resources are available to these officers, considering some of these really emotionally taxing situations that they can be in sometimes?
This job is very stressful, and we have officers out there every day putting their lives on the line for others. One thing we need to keep in mind are police officers are human beings, just like you and me. They have children, they have wives, they have moms, they have dads, brothers, sisters, so it affects them. Since officers are called when people are in crisis, Pace said that they can take on stress from experiencing a traumatic event. She said that they can become desensitized at the scene, but when they get home, that's when it starts to affect them. She described her personal experience with calls involving children. Sometimes you just want to go home and hug your children. I know I've been in that when I was in patrol. I've gone home many times and woken my kids up to just give them a hug because I just needed that, that comfort from them. Pace added that officers should know that it's okay to reach out for help if they need it. It's important to give them support, and it's important for us to provide them as much mental health help as we can so they can do this job effectively and help serve and protect our community. Brandon Schaff, 3 News.